Welcome back to the Morning Blend. Today, why now is the time to do something about those spider veins and varicose veins. One, summer is around the corner. And two, vein treatment is now easier than ever before, and sometimes insurance even covers it. Dr. Deborah Manjoney is the medical director of the Wisconsin Vein Center MediSpa. She's here with more on how to treat both cosmetic veins and the veins that are sometimes the sign of a medical problem.
Right.
Great to see you.
Thank you. Thanks for having me back.
So often we talk about these wonderful treatments that you do for our face to help us look younger.
That's
And all
right.
these great things. But another part of your business, your experience, your expertise is in treating veins.
And that's really where I got started. I was a cardiac surgeon, started doing varicose vein work because I knew people needed this kind of thing done with the newest treatments that were available back then. And things have even evolved and gotten better in the last 16 or 17 years.
Is it a fair statement to say if you have veins, whether they're cosmetic or the sign of a medical problem, there is absolutely, in today's world, no reason to suffer with them?
I would say that. There are almost every issue related to the vein disease in the legs can be taken care of. Certainly the vast majority. People who have deep vein problems, who've had lots of clots in the past, that we may not be able to do everything we could that we can do for everybody else, but there are still treatments that are available for just about everybody with any kind of vein problem.
Let's break it down a little bit, starting with varicose veins, because we have some before and after pictures here that show truly dramatic results. So this is a medical problem.
It can be a medical problem.
Okay.
A lot of people have varicose veins with no symptoms, and if that's the case, we can still get rid of them. We can still cosmetically improve your legs.
Wow.
But if somebody has symptoms, and there are so many symptoms that they can have that they may not even realize are related to their veins, like fatigue at the end of the day, heaviness, aching, leg cramps at night, swelling in the ankles. Many times people don't put that together and they think, I'm getting older, my legs ache. No.
Yeah, and especially if you have symptoms, there's a
That's
good
right.
chance that insurance might
That's
cover
exactly
it, right?
right. That's when insurance frequently will cover them, depending on the insurance company and exactly what the problem is. But we've been working with insurance companies now for 17 years, and so we know what things might be covered by your own insurance company.
I always wonder, as you look at it, can you tell from looking at someone's leg or their veins if it's a varicose vein versus, say, a spider vein?
We can tell that if they have a varicose vein, because those are the bulging veins on the legs, but we might not be able to tell if they've got a vein problem that you can't see on the surface. And that's why ultrasound is so important. It really has changed the approach to vein treatments over the last 20 years, because with ultrasound we evaluate a person standing up, so we see the effects of gravity on the veins, and we can diagnose problems that they don't see on the surface but that are causing their symptoms or maybe causing spider veins.
If we use the term spider veins, does that always mean cosmetic?
No, it does not. The treatment is always going to be cosmetic to actually get rid of the spider veins and erase them, which we can do with both a combination of a laser and injection treatment. But they may have, in some instances, a problem with another vein that should be taken care of in a different way, and that could be treated medically.
Spider vein treatment is sort of like a process, right? It's usually not just one
That's
treatment.
right. Almost always you'll need a second treatment because our veins are almost, I explain to people, it's like a fishnet stocking underneath your skin that you can't see. There's so many different connections of the veins that we have to go in and either inject or close something with a surface laser, and then another vessel may open that's a little bigger, and so it's a bit of a job to get them all done, but it works very, very well. And I remember when I had spider veins and I was a lot younger, I was like, where do I go to get these taken care of? Well, we can take care of you.
Yeah, in office.
In office.
And I mean, it used to be very involved, and there was a lot of downtime, and people would be wearing compression stockings for a really long time.
Yes, nowadays compression stockings, first of all, are a lot more comfortable. They stay
and they're almost stylish.
You could get them stylish. There are many you can get that are ridiculous colors and styles and are pretty funky, so people can choose whatever kind of stocking they want. We kind of just have the basics where we are, but we tell you where you can buy the others. And it's something you only really have to wear for a week after treatment, and just depending on your insurance company, you might need to wear the stockings ahead of time just to qualify for a medical need.
What's the first step if someone has vein problems, they're noticing some of those symptoms maybe, or they've got spider veins that they just want to get rid of?
Call for a consultation, and we will see the people and we'll go over what we're finding on our clinical exam and by taking their history, and then we can move them along in the proper direction for what they need next.
Do people have the ultrasound in the consultation, or is that tend to be a follow-up?
Not usually. It tends to be another appointment for that if they need an ultrasound. We don't always do ultrasounds. If somebody really has cosmetic spider veins, they have no symptoms at all, we'll talk to them about just treating them and see how they respond before we do an ultrasound. But either way, you know, if they have varicose veins, an ultrasound's essential, and it really will help them in knowing what's going on and getting them proper medical treatment and authorization from the insurance companies.
Yeah, which is wonderful that it's often covered. Here's the deal. Call this number to schedule a consultation. It's 262-746-9088. The Wisconsin Vein Center and MediSpa is located on Georgetown Drive in Pewaukee. You can visit them online at wimedispa.com to find out more. Always great to see you.
Thank you. And
Thank you.
all treatments are done in the office, whether it's varicose or spider veins.
All are in-office procedures.
In office and just through needle punctures. There's really there's no scarring.
It's wonderful. Great to see you. Have a
Thank
great
you.
weekend. Thank you.